All right, let's get started. Our first question comes from audience member Risa. Hi, Risa, what's your question?
Well, because of the increase in glaucoma lately and pancreatic cancer, I'm wondering if there's any connection, and is there anything we can be doing ahead of time so it isn't a surprise that you have glaucoma or pancreatic cancer?
We're very lucky. We have one of the biggest experts in pancreatic cancer here, Dr. Moore.
Pancreatic cancer is a serious illness. One of the biggest challenges with it is that, unlike some other cancers where you can detect it at an earlier stage by screening, such as mammography for breast cancer, because the pancreas is deep in the abdomen, it's very difficult to detect it at an earlier stage, and it's usually only found when people complain of pain, or they turn yellow, which is jaundice, or sometimes when they develop diabetes at an older age, it indicates there's a problem with the pancreas, and that warrants further investigations, which might turn up a cancer.
Is there any connection with a lot of people getting Lyme disease? Does it promote pancreatic cancer or glaucoma?
Not that we know of. I mean, people are always interested to try and understand cancers. If you can understand what causes them, it often makes it easier to treat. But as far as we know, the only things that really increase your risk of pancreatic cancer are actually probably smoking and also positive family history.
I see.
Next, we have a video question from Jamie.
Hi, I'm Jamie from Ottawa. I've been playing sports my entire life, but now that I'm getting older, I feel like I'm kind of getting injured all the time. I'm always sore. I'd rather not go see various specialists. So my question is, in order to prevent sports injuries or for rehab, is it best to see a physiotherapist or a massage therapist or a chiropractor? Thanks.
I am a physiotherapist, and we do work on the rehabilitation of injuries, but also the prevention of injuries. So as we age, as the activities of daily living, function is what we focus on. So if it is rehabilitating from an injury and then transitioning into the preventative stage, physiotherapists are trained in soft tissue dysfunction, in the stability, mobility, and flexibility of the joints and the strength of the muscles to support those joints. So as we age, as we continue to live an active lifestyle, it's important to stay on top of that and be preventative and try to offset that need for rehabilitation. However, like Jamie was asking, depending on what the injury is, physiotherapist, chiropractor, massage therapist, even a skilled trainer to help you work through maybe where some of the weaknesses lie, very, very beneficial. So the important piece is to know what you need and to find someone who's going to work with you to achieve those goals and listen to what function means for you.
So that means exercise in order to exercise, among other things.
Exactly. Exercise in a way that promotes mobility while fostering stability and leaning towards that functional strengthening component of exercise and of strengthening.
Dr. Rod, what about pain, and what about, I remember a lot of people will take ibuprofen before they play to prevent pain and inflammation. What about all that?
Yes, it's interesting because inflammation in our body when we have an injury, it's actually a part of our healing. Like we need the early inflammation to heal. But I was going to say that I agree with activity is very important and exercise, to do more exercise. But I always advise my patients, if your ability is 100, don't push past 60 or 70 or 80. Because that last 20% usually leads into re-injury. And then that, if it's not healed over the past treatments that they have had and using the medication that they should not have, that would lead into chronic pain. And then that's a whole different story that we can talk about.
Do you advise people who play tough sports to take a pill an hour before or not?
Again, I do not agree with taking anti-inflammatory for healing or preventing acute injuries, because that early inflammation is there as a part of our biology to heal the injuries.
There's also a big discussion about ice and heat, and does ice help or does it not help? Where are you at on that?
Well, I'm sure we could have a debate among the four of us, but ice constricts. Ice is going to constrict what's happening. So in an acute injury, we often suggest get ice on as quickly as possible to limit the inflammation to some extent so that it doesn't become chronic. Then we look to heat. Heat dilates. Heat opens the blood vessels. So when we're into more of that healing stage, chronic stage, we want to bring in the good stuff. We want to bring in the blood. That will help flush out the inflammation. Of course, ice can provide an analgesic effect depending on what the goal for the patient is or the injury. I don't know if my colleagues here disagree with me, but I would always say ice in that acute stage and then shifting to heat as kind of a rule of thumb.
Next, we have an email from Lee. He writes, my father has been diagnosed with lung cancer and is still smoking. His life, his choice, but if he stops now, will it extend his life and improve the prognosis? Dr. Moore?
That's actually an easy question to answer. The answer is clearly yes. And sometimes patients sort of say that, look, I've smoked all my life, I have a smoking-related cancer, so now that I have the cancer, I might as well keep smoking. The reality is the evidence suggests that if you continue to smoke, your survival from your cancer will be shorter and your quality of life will be worse. So most cancer centers like ours actually have a smoking prevention program for patients who have cancer to try and encourage them to reduce the smoking to give them a better chance of fighting the cancer. So the answer is yes.
Dr. Aaren, I'm sure that's a conversation you have with your patients all the time.
All of the time. So yeah, we usually recommend having screening visits, preventative visits with our patients as they come in. And one of the questions we commonly ask is, are you smoking? Smoking increases our blood pressure, it increases our risk for coronary artery disease, diabetes. So overall, if we're able to work with our patients to help either reduce how much they're smoking or quit completely, we're moving in a good direction.
We need to take a short break. We'll be right back with more of the Zoomer.